Hello and welcome. Why sex ed matters more than ever. Alright folks, hello and a massive welcome to Sex Ed Savvy. I'm so chuffed you're here with us today. We're diving headfirst into a topic that's, let's be honest, incredibly important but sometimes a bit hush-hush: sexual health. My mission, and the mission of this channel, is to arm you with knowledge. Because when it comes to your body and your choices, knowing your stuff is truly empowering. It's about feeling confident and making decisions that are right for you, without any shame or confusion clouding the picture. We're going to make learning about this fun, engaging, and super useful, I promise. Now, why is sexual health education so vital, especially in 2025? Well, the world keeps spinning and information and misinformation is everywhere. It's crucial to have a reliable, friendly place you can turn to for the facts. Understanding your body, how it works, and how to keep it healthy is a fundamental part of overall well-being. It's not just about preventing the not-so-fun stuff like infections or unintended pregnancies, though that's a big part of it. It's also about fostering healthy relationships, understanding consent, and feeling good about your sexuality, whatever that looks like for you. Think of it like this: you wouldn't drive a car without learning the rules of the road, right? Or try to bake a complicated cake without a recipe, unless you enjoy kitchen chaos. Sexual health is similar. Having the right information helps you navigate your experiences safely and enjoyably. It helps you communicate better with partners, understand your own needs and boundaries, and access the right kind of support when you need it. This isn't just about biology class diagrams. It's about real life, real connections, and real well-being for everyone involved in the dance of intimacy. So, here at Sex Ed Savvy, we're committed to giving you clear, approachable, and non-judgmental information. We want to create a space where no question is too awkward and where learning is a positive experience. Over the next while, we'll be covering some key areas. Think STI prevention, the wide world of birth control, the absolute necessity of consent, and even a little chat about products that can make sex safer and more pleasurable. Stick around, because knowledge is power, and you deserve to feel powerful in your own skin and your own decisions. Let's get savvy. Let's talk STIs. Busting myths and staying safe. Okay, first big topic on our list: sexually transmitted infections, or STIs. I know, just saying the words can sometimes make people squirm a bit, but knowledge really is your best defense here. So let's get comfortable with the conversation. STIs are super common, way more common than many people think, and absolutely nothing to be ashamed of if you do get one. The important thing is understanding how they're transmitted, how to prevent them, and what to do if you think you might have one. We're gonna bust some myths and get straight to the facts. One of the biggest misconceptions is that you can always tell if someone has an STI just by looking at them. This is a huge myth. Many STIs like chlamydia or gonorrhea often show no symptoms at all, especially in the early stages. This means someone can have an infection and be passing it on without even knowing it. That's why relying on visual cues is a no-go. Another common myth is that you can only get STIs from penetrative sex. Nope. Some STIs can be transmitted through skin-to-skin contact, oral sex, or sharing sex toys. So how are STIs actually spread? Well, it varies depending on the specific infection. Many are passed through bodily fluids like semen, vaginal fluids, and blood during sexual contact. This includes vaginal, anal, and oral sex. Others, as mentioned, like herpes or HPV, which can cause genital warts, can be spread through direct contact with affected skin or mucous membranes. Understanding these transmission routes is step one in protecting yourself and your partners. It's not about fear, it's about being informed so you can make choices that reduce your risk effectively. Another myth to debunk is the idea that clean people don't get STIs. STIs don't discriminate based on how often someone showers, their background, or how many partners they've had. Anyone who is sexually active can potentially get an STI. This isn't about judging anyone's hygiene or lifestyle choices. It's purely about exposure to bacteria, viruses, or parasites that cause these infections. Shifting the focus from shame to proactive health management is absolutely key. We need to talk openly and honestly to break down these harmful stigmas. More on STIs, your prevention toolkit and testing. Now that we've busted some common STI myths, let's chat about the really practical stuff: prevention strategies. The fantastic news is that there are very effective ways to significantly reduce your risk of getting or transmitting STIs. Topping the list, and probably the one you've heard most about, are barrier methods. Condoms, both external, often called male condoms, and internal, often called female condoms, are brilliant because they create a physical barrier that stops those pesky infectious agents in bodily fluids from passing between partners. They are your best friends for safer sex. Beyond condoms, regular STI testing is an absolute cornerstone of sexual health. Seriously, think of it like a regular health checkup just for your sexual well-being. How often you should get tested depends on your individual circumstances, like how many partners you have or if you're starting a new sexual relationship. Your doctor or a sexual health clinic can give you personalized advice. Getting tested is usually quick, easy, and often free or low cost. And remember, if you do test positive for something, it's treatable in most cases, especially when caught early. Knowledge is power here too. Another important aspect of prevention is open communication with your partners. Talking about sexual health history, testing, and what you're both comfortable with before you get intimate can feel a bit awkward at first, I get it. But trust me, it's so much better than dealing with an STI and regret later. It's about respect for yourself and for them. It shows you care about their health as well as your own. This kind of conversation can actually build trust and intimacy in a relationship. It's a sign of maturity and responsibility, not a mood killer. Finally, for some STIs like HPV and hepatitis B, there are vaccines available. These vaccines can protect you from certain strains of these viruses, which can have serious long-term health consequences, including some cancers. Chat with your healthcare provider to see if these vaccines are right for you and if you're up to date. It's another powerful tool in your prevention toolkit. So to recap, use barriers, get tested regularly, talk openly with partners, and explore vaccinations. These steps can make a world of difference in keeping you and your community healthier. Birth control basics. Finding what works for you. Alright, moving on from STIs, let's dive into the world of birth control, also known as contraception. This is all about preventing unintended pregnancies, and wow, there are a lot of options out there. It can feel a bit overwhelming trying to figure out which method is the best fit for your body, your lifestyle, and your future plans. But don't you worry, we're going to break it down. The most important thing to remember is that the best method is the one that works best for you. There's no one-size-fits-all answer, and what works for your mate might not be your cup of tea. Let's start with a quick overview of how different methods work. Generally, birth control methods can be grouped into a few categories. There are hormonal methods like the pill, the patch, the ring, injections, and implants. These work by releasing hormones that primarily prevent ovulation, your ovaries releasing an egg, or thicken cervical mucus to stop sperm from reaching an egg. Then there are barrier methods, which we touched on with STIs. Condoms are a prime example, as are diaphragms and cervical caps, which physically block sperm. Effectiveness is a super important factor to consider, and it varies quite a bit between methods. When we talk about effectiveness, we usually hear two numbers: perfect use and typical use. Perfect use is how well it works if you use it exactly as instructed, every single time without any mistakes. Typical use reflects how well it works in real life, including the occasional oopsie, like forgetting a pill or not using a condom correctly. Long-acting reversible contraceptives, or LARCs, like IUDs and implants, have the highest typical use effectiveness because there's very little room for user error once they're in place. It's also crucial to understand that most birth control methods do not protect against STIs. Condoms are the superstars here because they do double duty, helping prevent both pregnancy and STIs. So if you're using another form of birth control, like the pill or an IUD, for pregnancy prevention, it's often a really good idea to also use condoms to protect against STIs, especially with new or multiple partners. This is often called dual protection, and it's a smart strategy for comprehensive sexual health. We'll explore more specific methods in a moment. Section 5. Navigating your birth control options, hormones, and beyond. Let's delve a little deeper into some of those birth control options we just mentioned. Hormonal methods are incredibly popular, and for good reason. They can be very effective. The combined oral contraceptive pill, often just called the pill, contains estrogen and progestin. You take it daily, and it stops ovulation. There are also progestin-only pills, sometimes called the mini pill, which are a good option for people who can't take estrogen. Then there's the patch, which you stick on your skin and change weekly, and the vaginal ring, which you insert into your vagina and change monthly. These offer a bit more convenience for some. For those looking for longer-term solutions where you don't have to remember something daily or weekly, injections, implants, and IUDs are fantastic choices. The contraceptive injection, often known by its brand name Depo-Provera, is given every few months by a healthcare provider. The contraceptive implant is a tiny rod inserted under the skin of your upper arm that releases hormones for up to 3 years. Intrauterine devices, or IUDs, are small T-shaped devices placed in your uterus. There are hormonal IUDs which release progestin and can last for several years, and copper IUDs which are hormone-free and can last even longer, up to 10 or 12 years. Now, every method comes with its own set of potential side effects and benefits. And this is where talking to a doctor or nurse is absolutely key. For example, some people find hormonal birth control helps with acne, or makes their periods lighter and less painful, which is a definite plus. Others might experience side effects like mood changes, headaches, or spotting between periods, especially when first starting a new method. It's all about weighing the pros and cons for your individual situation. Your healthcare provider can help you navigate these choices based on your medical history and preferences. Don't forget about non-hormonal options beyond the copper IUD and barrier methods. There are also fertility awareness-based methods, sometimes called natural family planning. These involve tracking your menstrual cycle, body temperature, and cervical mucus to identify fertile days. While these can be effective for some, they require a lot of diligence and understanding of your body, and typical use effectiveness can be lower if not followed perfectly. And for those certain they don't want more children, permanent methods like vasectomy for men or tubal ligation for women are also options. There's a lot to consider, so take your time. Section 6. Consent is everything, the enthusiastic. Yes, okay team, let's switch gears to a topic that is, without a shadow of a doubt, one of the most important things we'll ever discuss on this channel: consent. Consent isn't just a buzzword, it's the absolute foundation of any healthy and respectful sexual interaction. It's not complicated, but it's crucial. Simply put, consent means that everyone involved in any kind of sexual activity has actively, enthusiastically, and freely agreed to participate. It's about ensuring that sex is something everyone wants, every single time, with every single act. No ifs, ands, or buts. What does enthusiastic consent look like? It's about looking for a clear yes, not the absence of a no. Silence is not consent. Being in a relationship does not mean you have ongoing consent for any sexual activity at any time. Wearing certain clothes is not consent. Being drunk or high is not consent. In fact, someone who is incapacitated by alcohol or drugs cannot legally give consent. Consent must be ongoing, meaning it can be withdrawn at any point, even if you've already started. If someone says stop or seems unsure or uncomfortable, that means stop. It's also vital to understand that consent for one thing, like kissing, doesn't automatically mean consent for another thing, like sexual intercourse. Each new activity requires its own consent. This might sound like a lot of talking, but communication is sexy. Checking in with your partner. Does this feel good? Are you comfortable with this? Do you want to try? Shows respect and care. It ensures that everyone is on the same page and genuinely enjoying the experience. These conversations can actually enhance intimacy and connection rather than ruin the mood. Power dynamics also play a role in consent. If someone is in a position of power over another, like a boss, teacher, or doctor, or if there's coercion, manipulation, or pressure involved, then it's not true consent. Consent must be freely given without any form of duress. Remember, you always have the right to say no at any time for any reason without having to explain yourself. And equally, you must respect someone else's no. Building a culture where enthusiastic consent is the norm makes sex safer, more respectful, and ultimately more enjoyable for everyone. Section 7. Condoms and lube, your bedroom besties for safer fun. Let's chat about some very practical tools for your sexual health toolkit: condoms and lubricant. These two can be absolute game changers for making sex safer and often more comfortable and pleasurable too. We've already mentioned condoms as being fantastic for preventing both STIs and pregnancy, so they really are a bit of a superhero in the bedroom. There are different types, sizes, and materials, so it's worth exploring to find what works best for you and your partners. Knowing how to use them correctly is key to their effectiveness, so let's quickly cover that. First up, condoms. The most common type is the external condom, usually made of latex, which is rolled onto an erect penis before any sexual contact. Always check the expiry date on the packet. Yes, they do expire. And make sure the packet isn't damaged. When you open it, be careful not to tear the condom with your teeth or sharp nails. Pinch the tip of the condom as you roll it on to leave space for semen and to squeeze out any air, which can cause it to break. After sex, hold the base of the condom as you withdraw, then wrap it in a tissue and pop it in the bin, not down the loo. Now let's talk about internal condoms, sometimes called female condoms. These are pouches, usually made of nitrile, a soft plastic that you insert into the vagina or anus before sex. They have a flexible ring at each end, one to help with insertion and keep it in place inside, and an outer ring that stays outside the body. These are a great alternative if latex is an issue, or if one partner prefers to take charge of this barrier method. Just like external condoms, use a new one for every act of sex and dispose of it properly. Don't use an internal and external condom at the same time, as the friction can cause them to break. And now for our slippery friend, lubricant, or lube. Lube is amazing. It reduces friction, which can make sex more comfortable, more pleasurable, and can also help prevent condoms from breaking or causing irritation. There are different types of lube: water-based, silicone-based, and oil-based. Water-based lubes are super versatile and safe to use with all condoms and sex toys. Silicone-based lubes last longer and are great for water play, but they can degrade silicone sex toys over time, so check that. Oil-based lubes like petroleum jelly or baby oil should not be used with latex condoms as they can weaken the latex and cause breakage. Always check compatibility. Section 8, Real Talk Tips, Stories, and Expert Wisdom. So, we've covered a lot of ground: STIs, birth control, consent, condoms, and lube. Sometimes hearing from others or getting those little extra tips can make all this information feel more real and manageable. One piece of advice that experts always stress is the importance of finding a healthcare provider you trust and feel comfortable talking to. This could be your GP, a nurse at a sexual health clinic, or a gynecologist. Having that open line of communication means you can ask all your questions, no matter how awkward you think they are, and get personalized, professional advice. They've heard it all, trust me. I often hear from viewers who share their own experiences, and a common theme is wishing they'd known certain things sooner, or felt more empowered to ask questions. For instance, someone once told me how they struggled with painful sex for ages, thinking it was normal, until they finally spoke to a doctor and discovered lube and pelvic floor physiotherapy could make a huge difference. Another person shared how much relief they felt after finally getting tested for STIs, and realizing it wasn't nearly as scary as they'd imagined. These stories highlight how taking proactive steps can really improve your quality of life. Experts also emphasize that sexual health isn't just about the physical, it's deeply connected to your mental and emotional well-being. Feeling anxious about sex, struggling with body image, or navigating relationship challenges can all impact your sexual health. Don't be afraid to seek support for these aspects too. Talking to a therapist or counselor or even trusted friends can be incredibly helpful. Remember, you're not alone in whatever you're experiencing. Many people go through similar things, and there's support available to help you navigate them. It's all part of being human. One final tip that often comes up, both from experts and from everyday people, is to be patient with yourself and your partners. Learning about your body, figuring out what you like and don't like, finding the right birth control, or getting comfortable talking about sex. It all takes time. There might be some trial and error along the way, and that's okay. The journey to sexual well-being is an ongoing process of learning and discovery. Be kind to yourself, keep asking questions, and keep prioritizing your health and happiness. You've got this. Section 9, Knowledge is Power, Your Sexual Health Journey, and a quick disclaimer. And that brings us towards the end of our deep dive today on Sex Ed Savvy. We've journeyed through the essentials of STI prevention, explored the myriad of birth control options, underscored the non-negotiable importance of enthusiastic consent, and even chatted about condoms and lube. My biggest hope is that you're leaving this feeling more informed, more confident, and more empowered to take control of your own sexual health. Because honestly, knowledge really is power. When you understand your body, your choices, and your rights, you're in a much stronger position to make decisions that are healthy and right for you. Remember, your sexual health journey is unique to you. There's no single right way to be, and it's okay if your needs and preferences change over time. The key is to stay curious, keep learning, and never be afraid to ask questions. Seek out reliable sources of information like this channel, hopefully, and trusted health organizations. Talk to healthcare professionals. Communicate openly and honestly with your partners. These are all vital steps in nurturing a positive and healthy relationship with your sexuality and your body throughout your life. It's an ongoing adventure of self-discovery. Please always remember that while we strive to provide accurate, evidence-based, and empowering information here on Sex Ed Savvy, this content is for educational and informational purposes only. It is absolutely not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your doctor or another qualified health provider with any questions you may have regarding a medical condition or your sexual health. Never disregard professional medical advice or delay in seeking it because of something you have read, heard, or seen in our content. Your individual health needs are paramount. Thank you so much for joining me today. I hope you found this helpful and perhaps even a little bit enlightening. Don't forget to like, subscribe, and share if you think this could help someone else out. Keep learning, keep growing, and keep taking care of yourselves and each other. Stay savvy, everyone, and I'll see you in the next video for more chats about all things sex, health, and relationships. Bye for now, and take good care of your wonderful selves. You absolutely deserve to feel good and informed.